I want to talk to you a little bit about the three presenters that you're going to meet today. I'd like to start with Mariah Funk, who is a community service supervisor at Victor Community Support Services. She brings extensive expertise in transitional age, youth, and behavioral interventions to her work. She was previously the community engagement manager for Big Brothers Big Sisters, where she built the Bigs with Badges program to bridge the gap between youth and local law enforcement. In addition, she was the assistant residential facilities manager at a short-term residential therapeutic program where she trained support staff, oversaw daily management of the boys' household, and provided crisis intervention. So welcome, Mariah. We also have Mimi Greminger, who started her career working with severely emotional disturbed children in a school setting and has worked as a child welfare social worker in Butte County for over 20 years. She has experience as an ongoing social worker, IR/ER investigator, family law investigator, and court presenter, and moved into a supervisory role in 2012. Mimi began working with Nevada County Child Welfare Services in 2019, where she currently supervises intake, emergency response, and resource family approval. And we also have Terry Polsine, who has served in multiple roles in Nevada County Social Services since 2013, including eligibility worker, ongoing social worker, court reporter, IR/ER investigator, and family law investigator. She is currently a child welfare emergency response social worker. Early in her career, she worked as an educational therapist in Southern California. Terry also has experience as a foster adopt parent, bringing a unique perspective to her work. She has extensive experience navigating multiple systems, including mental health, education, and the court system advocating for children. And with that, I want to pass it on and say thank you all so much for being with us. We can't wait to listen to your presentation.
Thank you so much for giving us the introductions, Jessica. We're here today to talk about our rapid response team. This program is a collaboration between Victor Community Support Services and Nevada County Children's Welfare Services. I apologize. This is just our quick little intro. So this does have everything that Jessica just read off. I'm Mariah Funk, and I'll let the other two kind of quickly introduce themselves.
Hi, I'm Mimi Greminger, and I supervise emergency response investigators.
And I'm Terry Polsine. I'm one of the IR emergency response social workers that Mimi supervises.
All right, so we're going to do a poll. We have a couple of polls coming up for you. So Haley, could you go ahead and send out the first one? Great. So we want to know where you're from. Are you from child welfare, probation, community support services, education? Tell us where you're from, please. I see CASA. Good. Do we have results on those yet? Okay. Great. A lot of nonprofit communities. This will be great with Mariah here, being able to talk about what they do, and then child welfare. We'll share with you what we do. And then we have some from other. So probably CASA, public health. So nice. Thank you all for coming. Our second poll is your rural or urban county. Can you tell us where you're from? And do we have results? Okay, a lot of you from urban. All right, thank you. Okay. So we're going to present to you our rapid response team. That is the collaboration, like we said, between Victor Community Services and Child Welfare Services. Through this presentation, we're going to give you a program overview. We will show you the services that are offered and share with you what those look like. And then we'll also share what our data and outcomes are currently. They're preliminary outcomes, but we will share those with you.
Right, so I'm going to present on program origin. So how did rapid response originate? So Child Welfare Services is required to offer preventative and early intervention strategies to meet the critical safety needs of children who are referred to the child welfare system. These services target the overall well-being of families, and that's exactly what RRT does for us. RRT provides child welfare with a team of people who can offer direct services to families to mitigate safety concerns, stabilize the home environment, and provide linkage to more long-term resources. The goal is to reduce further referrals or further child welfare involvement. So RRT was created to fill a gap in our services. We found that families respond to and engage in services more often and with more success when we can get those services to them right away at the beginning of contact. We have found that if we wait too long, or if there's not enough, if we don't get the services in right away, then we kind of lose them. They feel that they've stabilized. So RRT offers immediate hands-on assistance to families at a level between a Path 1 response and a voluntary case. Clients don't need to meet criteria for wraparound services, but they'll be offered similar support through the Rapid Response Program. They don't need to be at immediate risk of out-of-home placement. They don't need to meet medical necessity for mental health services, and they don't need to qualify for Medi-Cal.
Okay, so our roles in this, we meet every day. We've got a team of investigators and myself as a supervisor, and I have 4 investigators who are on my team. And Mariah?
On the Victor side, our teams are made up of facilitators who hold more of a case manager type role, and then a family support counselor who focuses on skill building and typically have lived experience with CWS. Those are the 2 staff that are going to provide a lot of the direct services to our clients. And then we have a program supervisor who currently is myself. The staff all come from different backgrounds, have different experiences and strengths. We try and make sure if there's a gap, we're filling it. So we have some that come from an educational background, some that come from a behavioral intervention background, some from like substance treatment backgrounds. And then we offer a different array of trainings since we work with such a wide variety of people. We'll offer a life space crisis intervention training, which is a behavioral intervention. We'll offer CSEC training, a 40-hour domestic violence training, a nurtured heart approach, and then also our peer certification trainings.
Okay, so how do referrals come to us? So the rapid response referrals come through child welfare, through a child welfare referral. And I notice many of you are with child welfare, so you're going to understand how the referrals come in. Typically, it starts with a suspected child abuse report, but just because we get a child SCAR doesn't mean that it's going to turn into a rapid response referral. We use a collaborative client identification process to determine if a referral will be made, and that's through our RED team. We meet every morning. Child welfare and our team meet with our RED team, and that stands for review, evaluate, decide. And that's what we're doing to even decide what child welfare's response is going to be. But at the same time, we look at if this family seems to be a family that might need some intervention right away, and then we would maybe make the referral for RRT. Families who are referred typically need support at mitigating safety concerns and to be linked to community resources to help stabilize their family relationships and home environment. Referrals typically include reports on mental health concerns, domestic violence, help accessing community resources, and just skill building. And what does rapid mean? So rapid response is immediate. And well, it's not always immediate, but it's rapid. And the reason that we do this is because we have found that, like I said, oftentimes too much time goes by between the time that a social worker responds and we can get services in place. So the rapid response team can go out with a social worker who's investigating a referral immediately on an IR referral. If the referral's deemed to be a 10-day response time period, then we can do a joint response with rapid response team. So they'll go out with us when we make our initial response. If we go out on a 10-day and there was not a referral made originally, but we're out there and we're talking with the family and we feel that they could benefit from the rapid response team, then we bring it back to Red Team. We talk about it and we make the referral then, and then we'll do a warm handoff with the family.
The RRT program structure is set up to be really flexible to meet any family's needs. I always say best way to explain it is like it's social work at its core. It's that social work without all the red tape, or you have to jump through all those hoops to meet a client's needs. Typically, we are seeing it's a short-term program, so we're working with clients anywhere from 3 to 6 months to address or address the immediate safety concerns that are happening in the household. Clients can be in services longer if needed. I had a client that I worked with for almost a year when I was a facilitator on the team because of how high needs the case was and how much support they needed. So if we break down what the program structure is, the first phase is typically your engagement phase. So during this engagement phase, you're completing your intake paperwork. We always make sure we have a safety plan to help set that family up with. We work on what we call a connection map, which is where we go over all of the family support systems or connections within the community, people that they can rely on that maybe aren't the RRT team. And then we identify any, immediate needs and supports there. We also go into the rapport building. Rapport is really big on this program. A lot of these families are coming from, system fatiguement, or maybe aren't so sure about having a social worker show up at their house and tell them they have to work with these people. So we really focus on rapport building. The next phase is going to be our planning phase, where we complete the Adult Needs and Strengths Assessment, our ANZA. We utilize the ANZA for help creating goals, our data tracking that we'll talk about later, and just a way to kind of gauge where this client is at. And then we start creating individualized plans and goals. During phase 3 is our implementation phase. We're meeting with the client regularly. We are, meeting them in the home or out in the community. Typically it's once a week. Sometimes it's more, depending on how high needs they are. We're really starting to develop our action steps here. We're helping them follow through with those action steps, and then we're linking them to local resources. We frequently collaborate with community partners and really offer ongoing case management, and can offer child and family team meetings as needed for the families. Our final phase is going to be our transition phase, where we gradually decrease our frequency and intensity of services, and then start identifying and utilizing ongoing community supports or natural supports. We complete a closing adult needs and strengths assessment, and then also complete some discharge surveys, which is another form where we get our data from. So the rapid response team comes kind of as a sister program almost to our wraparound model. So the program principles are pulled right from RAP. So we always focus on voice and choice. We want that family to express their needs, and what is this need for you may not be the need for child welfare or for us. So we're going to address both. We always include all of the family and team, and the child in the home as well. We are community-based services, so we're typically in the home, meeting that client's needs there in the home instead of forcing them to come into the office. We can offer different transportation support. I have clients that are I just need to get out of the house. Can we meet for coffee? So it's very community-based depending on what that client's needs are. We always look at things through a cultural competency lens. We individualize our services based on their needs and where they are. And then we are strengths-based. I always want to focus on the positives. It's really easy to look at all the things that aren't working, but what's working for you right now. And then we work on building natural supports, people that this client can rely on once we are no longer in the picture. We do a lot of collaboration with different community resources and teams. Persistence is a big thing here. I always say we're a little pushy, and that's my favorite word to use. I spin it in a very strengths-based way. You know, I'm gonna show up if this client isn't responding to me, and that's out of the ordinary. I'm gonna knock on your door. I'm gonna see what's going on. I'm gonna make sure that you are engaged in services and your needs are being met. And then we are an outcomes-based service. This next slide is going to go over kind of our goals and objectives. So I'm just going to read through them. So RRT's goals are to prevent and reduce out-of-home placements and placement disruptions for higher levels of care. So our objective is that 75% of child and youth served shall be stabilized at home or in a foster care. Caregivers shall strengthen their parenting skills. At least 80% of parents shall report an increase in their parenting skills as evident by the adult needs and strengths assessment. The third one is every child reestablishes, or reinforces a lifelong relationship with a caring adult. At least 65% of children served shall be able to identify at least one lifelong contact as evident by the connection map. Caregivers shall improve connections to the community. And at least 80% of caregivers shall report maintaining or increasing connections to natural supports as evident by the connection. The fifth one, youth shall be out of legal trouble. At least 70% of youth shall have no new legal involvement. So this means arrest, violation of probation, or any kind of citations that are coming through. Our final goal for the RRT program is to reduce the amount of involvement with CWS and probation. And the objective is going to be that 70% of families who graduate having met their treatment goals shall not have a referral to CWS or probation in the next 12 months following the RRT case closure. We define people that have, met their goals as people who have engaged, actively worked with us, and have kind of addressed the biggest safety concerns in the home.
And really quick, just to add to that, I know we've talked about referrals here, but we also are serving families who have open cases and maybe they're getting ready to transition into family maintenance. We also have made RRT referrals for families. We have an IECPC family who needed some help. And when families are closing, but they maybe need a little bit more support. So we've made referrals to RRT with that. And then we partner with probation really well. And when probation has a youth on their caseload that maybe the family could use some extra support, we will take a referral from probation and we will connect them with the rapid response team as well. And they have helped, I can think of a couple of probation youth who have been engaged with their families in this program, and it's been successful.
Yeah, and similarly, we get referrals from family court where people have applied for guardianships or families are struggling and the courts actually, kind of refer them back to us. Okay, so after the warm handoff. So basically the warm handoff is that piece where child welfare and rapid response team go out together in whatever way. We either respond together or we do the warm handoff after the social workers made contact. At that warm handoff, we have found that we have a lot more success with families when we go out together at that point, instead of just saying, oh, someone from rapid response is going to contact you. When we go out together, not only is it helping them to feel that we're a team all working together, but it also has been giving social workers a better kind of rap in a way, because they see that the families see that we're not there to tell them, that they're bad parents or be punitive. Instead, what we're doing is we're getting them connected with a really great program. So after the warm handoff, the social worker will continue their investigation if they need to, if there's more that needs to be investigated. When we do the warm handoff, that's usually that engagement piece for the rapid response team. They're doing their intake at that time. If the social worker needs to have continued contact with the family, they'll do it with rapid response. We usually don't go out on our own again. And then when we're finished with our investigation, we close our referral and we step back. And that's the piece that I think really helps families feel really more comfortable. They're much more comfortable to work with rapid response. Sometimes they don't want to work with child welfare, but it does give us a little bit more of a positive view by them. They're viewing child welfare in a little bit warmer light because we're here to help them, not to be punitive.
All right, I've got the next 4, so you're gonna have to listen to me talk a little bit more. So services offered through the RRT program, for the most part, we can figure out a way to meet the client's needs. So we offer immediate and long-term safety planning, crisis de-escalation skills, linkage to necessary community supports such as mental health services or substance use disorder services. We really come alongside and support families through navigating the legal system. We coordinate with schools and other systems, so attending IEPs, helping request IEPs, working with the schools to figure out how we can address behaviors in the schools, providing transportation to schools or to and from school. We can offer in-home support to address behavioral needs or provide coaching to the caregivers. We do a lot of non-legal mediation around family conflict. So just being that, non-biased third party that can sit in the room and help do some conflict resolution is really helpful for a lot of families. We can hold child and family team meetings to create, that more sustainable system that will help, that will help the family be able to continue to build rapport with different community resources. We do offer flex funds to bridge gaps for immediate needs. So if a client needs their rent paid, we can help with that. If a client, their car is broken down, we can do that. If their baby needs a crib, we can support with that. Gas money, that kind of stuff. As long as it's linked to their goals, it's something that we can support with. We really encourage contact with positive peers and different supports. Usually the people you surround yourself with has a big impact on you. So being able to have somebody that can celebrate your successes and offer that emotional regulation is really important. I had a client that I worked with for a couple months that I went over to her house and we folded laundry because she was a single mom of 4 girls, and that was her biggest stressor. We would call people together and we would sit there and fold laundry and just talk about her life. And just being able to hold that positive, appropriate space for her really helped her self-reflect on the different kinds of relationships she had in her life. We're able to offer parenting strategies and coaching, and then support with education as well. So engagement with RRT, this kind of breaks down what our staff are doing with them. So we, at the initial meeting or the warm handoff, we really focus on completing that intake paperwork, gathering more information about the family needs. And typically I would always leave the client or family with a task to do, right? Next time I come, I really want you guys to bring some things that you want to work on, or I hear that your mental health is your biggest concern right now, but you don't want me to sit with you while you call behavioral health support. So next time I come, I'm going to follow up with you and make sure that you've done that. Kind of leaving them with something to feel accomplished about and something that's concrete. Depending on their level of functioning, it's going to look different for every family. Our second meeting is typically really focused on rapport building. Like I said earlier, a lot of these families are a little concerned of us coming in and unsure. So I really try and make that about that personal connection and just try to gain more information from them on how I can best support them and what I can do to meet their needs. And really the family needs are going to dictate how frequently we meet and what resources or referrals are going to be made. So if it's a high needs family, like I said, we can meet multiple times a week. If it's somebody who only has a couple things that they need help with, maybe it's every other week. It's really just making sure that we can provide those services that help break down barriers and help them complete tasks that need to be completed. We really focus on, flexibility and the few barriers that we do have. Like, we're going to do whatever it takes to make sure that their needs are being met. Like I said, this is true social work at its core without all of those barriers. So it makes it really easy to be able to meet those families' needs. We really work on being patient, consistent, and persistent with contact. I've had a family where the mom, she told me at intake, I always sign up for help and then I can't follow through. I don't know what it is. It's just like 2 weeks after 2 meetings, I stop attending. And so I asked permission. I said, okay, are you okay if you stop contacting me? I show up here so that I'm able to support you in signing your daughter up for mental health services. And she said yes. And sure enough, a couple weeks in, she stopped contacting me, and I drove out there, knocked on the door, and she kind of opened the door and gave me the eye roll. She's all, I should have told you couldn't come out here. But we were able to get her daughter enrolled in mental health services and help support them with, fixing their car and also paying rent. So it was a real benefit to the whole family and addressing the potential safety concerns that were in the way. So that persistence is really key to our success. We always offer non-judgmental support and try and be as encouraging as we can. This is also a voluntary service, so we always emphasize that if a family doesn't want to be involved with us, they don't have to be. And sometimes just being like, meet with me a couple times, and if this isn't for you, you can say no, goes a long way with that family. We try and be strengths-based yet very realistic. I'm a big let's lean into those difficult conversations and address the issues, because if we're not talking about it or addressing it, how is it ever going to change? And then we typically work in teams of 2 with the facilitator and a family support counselor. So working in those small and effective teams really gives us the ability to put energy into team building or into building rapport with the client. We try and keep our caseloads very manageable. So typically we don't go over a 20-person caseload. We bill at a 65% for our billing time. So as long as 65% of the hours worked are billed, that's where we cut off. So that way we're still able to manage all of our clients' needs. And then we utilize evidence-based practices. Here are some common community partners that RRT partners with or will connect families to. So we work really closely with the domestic and sexual violence services in Nevada County, the substance use disorder services, a lot of the Medi-Cal-based programs we work closely with, our wraparound services that provide support to youth and families, behavioral health, public health, probation, food banks, schools, youth services. We have a kind of like teen youth center here in Nevada County that we partner really closely with. Parenting resources, and then also autism services are all community partners that we will link people to. So RRT does have an on-call component. So the rapid response team is not available to clients outside of working business hours, but we are available to the social workers. So what we do, though, to kind of meet clients' needs, because not everybody is available in that 9 to 5 window, is that we adjust our schedules to meet with them, or we do provide them with a list of emergency services or services that are 24 hours a day, and kind of we do at intake, we give this to them and we discuss just the resources that they can utilize outside of our business hours or out on the weekends.
To add to that, just to give an example of a moment where rapid response team responded immediately. We had an after hours worker. We've had it a couple, but this one in particular, it really could have led to a child being removed. Our social worker who was out contacted the rapid response team. A worker showed up, got involved right away, and it wasn't a rushed process. Everyone took the time with the family, and in the end, the parent, the primary caregiver, was able to make choices that were best for the child, kept the child safe. We did not remove the child from that parent's home, and rapid response team continued to work with that youth, and that youth stayed with mom. And we didn't have to stay involved, and that was really great. And they kept that family involved with rapid response team for, I want to say, like up to 6 months. That's what they needed. So they met the family where they were at, took the time with them to, part of that's with us too, de-escalating families, and then just being able to talk about things. And sometimes things that come up in some of the referrals that we investigate are real difficult conversations and difficult information for parents to hear. So both the investigator and the rapid response team facilitator who responded took that time with the parent. And in the end, that youth was able to stay with their parent. When we've had others where they've gone out and right away have taken parents to court to get them, to help them resolve whatever, court matter that they're in, get custody, get emergency restraining orders. And that has also helped with keeping children safe and staying in the parents' care. Okay, so I know we have some child welfare people joining us today, but we also have some who are not. So we just want to talk about some investigation conclusion types, or the 3 investigation conclusion types. Our workers can go out and, we go out on the allegations that are reported. Those allegations could be unfounded, meaning the social worker gets out there and finds that none of that is true. However, the family could have some additional needs. We assess for everything every time we go out. And so if that family, if they identify some needs, the family could use some support, extra support with addressing. That could lead to a rapid response team referral. So it could be unfounded, but we still refer. Inconclusive is our social workers go out and there's evidence there that says something happened, but not enough evidence is obtained through the course of the investigation to determine that it's definitely, we have enough evidence to say that it did happen. And that could be something like there's inconsistent disclosures, dates are off, or one child says this, one child says this. Sometimes the youth are young and can't disclose anything, can't talk if we have babies. And so we can't say whether or not the child has been impacted by the alleged allegation of abuse or neglect. So that would be inconclusive. Again, we can make a rapid response team referral. And again, in something like that, if the family identified another need, we could definitely refer to rapid response team. And even when allegations are substantiated, we go out there, general neglect, dirty home, animal feces, can't cook, no food. We have gotten rapid response team out there sometimes right away. Sometimes we have to come back, staff it with them, and we do a warm handoff. But those allegations would be substantiated, and we can still keep kids in the home because rapid response team has come out. They've actually, Mariah, you were one of the workers who responded on a home that there was a team of people, the parents support network, church, rapid response team, and one of our social workers went in and cleaned this house. And although the allegations were substantiated, they helped this parent get their home clean. Child was able to stay with them, and then the parent and continue to work with rapid response team. And again, we were able to help a family stay intact instead of taking a child and putting them in a resource family home while the parent worked in services. We kept them intact and they were engaged in services. Next slide. Okay, so as I said in the beginning of our presentation, our outcomes, the findings that we have are preliminary. We started rapid response team in January of 2021. So we are collecting data as we go. So we continue to say, because it's only been 2 years, very preliminary findings. So in those, there's 194 referrals unduplicated, meaning these aren't like the 194 unduplicated referrals are referrals that are new. It's not the same. Sometimes we'll get the same person, or I'm sorry, a different reporting party calling in something that happened before. These are brand new referrals since the start of the program. Preliminary data is showing that 22% of the families who have closed successfully, and we'll give you a definition of what that means in a minute, they have had a repeat investigation in the 12 months following their referral to the program. And of those, 78% had no new investigations. So that's good. In half of those investigations that we have done, the findings were unfounded, meaning the abuse wasn't there. That's good. So closed successfully, like I said, we talk about that. It's when a family has engaged and they've either met their goals or they've been successfully linked to services and they don't need that extra support from rapid response team because they're connected with the resources in the community and doing well independently with those resources. Of the families that we referred to rapid response team, but those families did not engage, whether they declined services or sometimes they say, yes, we'll do the warm handoff. Rapid response team will go out and meet with them and then go back out and the family's not there. They don't respond. They don't respond to texts. They don't respond to calls, not home. If they are not engaging, we're seeing that 36% of those families have a new investigation. Referrals that were closed due to lack of engagement, we're finding are more likely to have a subsequent investigation, as well as that investigation having a substantiated finding or an inconclusive finding for those allegations. There's no substantiations for subsequent investigations within the year following referrals on families who closed successfully. And then the recidivism we are seeing is more likely. So those repeat referrals we're getting, and they could be old, or they could be allegations that have already been presented to us. They could be new allegations, but we're seeing that the recidivism is more likely to have another referral in that family when that family has not had contact with rapid response or hasn't engaged with rapid response team.
These are kind of pie charts that go along with this last slide. So like Mimi said, closed successfully is when they've engaged in services, they've met their goals, they've actively worked with us for those, 3 to 6 months. So this first pie chart actually goes into the investigation reoccurrence. So they potentially had another IR come or a SCAR report filed against them. So from the 63 families that closed successfully that had another SCAR report come through, 78% of them had no investigation was needed. So they were evaluated out. 9% were inconclusive. 11% were unfounded. And 2% at the time of this chart were still under investigation, and there were 0 substantiated reports found in the new SCARs. Versus the families that were potentially referred to RRT and closed unsuccessfully, so they were refused services, they didn't engage, they potentially moved out of the area. Out of the 68 families, 56% of them did not have any new investigations. 19% were found inconclusive. 12% had substantiated investigations. 10% were unfounded, and 3% were under investigation at the time of this pie chart. So this shows that if a family is engaged in the RRT services and has met their goals successfully, they have a much lower rate of having a substantiated child abuse report come through. These bar graphs show the first one goes over the amount of SCARs that have come through in a year. So allegations of neglect or child abuse by the fiscal year. RRT started in the 2021 fiscal year. So we're looking at the yellow and blue bars. So as you can see, the number of expected abuse or suspected abuse reports that have come in have been pretty consistently across the last 3 years. And this bottom bar graph goes over the amount of children entered into the foster care system. So as you can see, the amount of children in foster care has dropped significantly, almost by half the year that RRT had started. And we've kind of seen that trend continue in the 2022-2023 fiscal year. So even though we're getting the same amount of allegations coming in, we're seeing a significant decrease in the youth put in foster care that have engaged with RRT. This slide goes over when we talked about RRT objectives earlier. That's actually what this column on the first column is. All of this data goes over, or it comes from our ANZAs, which is our adult needs and strengths assessment, and our closing surveys. So this is assessments that are done with the clients or the surveys that the clients are doing themselves. So what we see is so at least 75% of clients were stabilized in the home or in foster care. So we've seen that this goal was met this last fiscal year, and that 45 of 47 discharged clients, so 96%, reported stable living situations, so either at home with a relative or in foster care at discharge. At least 80% of parents report an increase in their parenting skills. So our achievement was that this goal was met, as 31 of 37 caregivers, 84%, reported improvement caregiver needs on the ANZAs. And then at least 65% of clients identify at least one lifelong contact. Our achievement was that this goal was met, as 45 of 47 engaged discharged clients, 96%, reported at least one lifelong contact made. And our next objective would be at least 80% of caregivers report maintaining or increasing connection to natural supports. Our achievement for the 2022-2023 fiscal year was this goal was met, as 37 of 80 or 38 caregivers, 97%, reported maintaining or increasing connections to natural supports. The objective that at least 70% of youth shall have no new legal involvement. Our achievement was that this goal was met, as 37 of 38 clients, 97%, resolved their legal involvement by engaging at the time of discharge. So what we see is that 70% of families who graduated, having met their treatment goals, shall not have any new referrals to CWS or probation in the 12 months following case closures. So in initial analysis by Nevada County Child Welfare Services strongly suggests that engagement with the rapid response team significantly reduces further referrals and investigations. So our preliminary data shows that 90% of families who participate in the program and successfully close have not had another investigation take place.
So as we've been talking here and talking about meeting the objectives and what we're seeing in Nevada County, as we've shown in the bar graphs, is we are seeing a decrease in the number of detentions. We actually, in the very first year we started working with Rapid Response Team, our department did not detain a child from January through May. Again, we're not leaving kids at risk. We are doing everything we can to prevent. And in the circumstances that we have to have a higher level of intervention, we absolutely do that. But our rapid response team has been so successful with helping our families. We are decreasing the number of voluntary cases that we've had. We are seeing an overall decrease in our child welfare cases. So our social workers have gone from, we had 40 cases for one social worker, and those are down tremendously. Rapid response team is really helping more families stay intact and address the concerns that are present in the home, whether they're identified by our callers, our reporting parties, or these are concerns identified by the parents, the family, the kids. The children have a voice in this. any collaterals that are involved with them. So we're seeing some great work being done and support networks being improved. We're seeing a benefit in that there's preventing further experiences of trauma for children when they're removed. We have greater health and well-being for families in our communities. They're learning the resources in the community. They're asking for help. They're hearing their voice. They're making changes in their lives. And like we showed you earlier in the charts, we are seeing a decrease in the number of repeat referrals. They're taking the tools that they're being taught and exposed to, and they're putting those into practice. So that's great. We have, like Terry said, with the rapid response team coming out with us and us keeping families intact, we are having a better positive image in the community. And we have actually had community resources call and say, how can we get this family involved with rapid response team? So it's really good to hear that, you know, we're out there, rapid response team is out there and learning about family, community, and really just keeping kids together with their families. And then, of course, the money that's being saved by not having kids in care, we're putting more investment in the families intact than investing in children in foster care. And it's just been a great experience with rapid response team. And I know that our workers are appreciative of the work that they do in providing the support, like I said, even in open cases that are going from family reunification to family maintenance. Families of, you know, out of state who have some challenges sometimes with accessing the services in the community because that youth doesn't have Medi-Cal, they're not familiar with the resources in the community. It's been really helpful with stabilizing placements. And then those families who are closing but, you know, want that extra support, they're there for them. It's been a really good experience there. So how is Rapid Response Team funded? Nevada County is using our 2011 realignment dollars to fund. And we did also have some money from our Senate bill, our SB 163 wraparound funds that we've used. But currently, my understanding is that we're just using the realignment dollars. But there are some other funding options out there. Looking into Office of Child Abuse Prevention funding through their Child Prevention and Intervention and Treatment Program. Some community-based child abuse prevention programs, promoting safe and stable families. These are some funding options for county agencies to look into to start up a program like this if you're interested. There's also the Family First Preventative Services Program. So we have the Families First Transition Act, which is time limited, the Families First Prevention Services State Block Grant, and there are some comprehension plans that are required with that. There's also the Families First Preventative Services Act. Some Title IV funds may be able to be utilized for that. So, you know, for the county agencies who are here, you know, take this to your program managers, your directors, and see what funding is available in your county. But we are using the realignment dollars. Okay, so some recognition that the Rapid Response Team has received a merit award from the California State Association of Counties in 2021, recognizing the most innovative programs developed by California's counties.
The Rapid Response Team was also awarded the 2022 Achievement Award by the National Association of Counties. The National Association of Counties Achievement Award Program is a non-competitive award program that seeks to recognize innovative county government programs. And then we're also currently, we've been invited to submit our program to the California Evidence-Based Clearinghouse as a promising practice. So we're currently in the process of doing that as well.
So if you're interested in learning more or you have questions for us outside of this training, these are some our names, email addresses. Please feel free to contact us, ask us questions. If we don't know the answers, we'll get you the answers. And that is the end of our presentation. So we'll take a look at the Q&A box. So Kelly says, speaking of resources to help with rent, does anyone know of any programs that help people pay back rent accumulated from COVID? Kelly's based in Alameda County in the Bay Area, and Season of Sharing is the only program that I know about. So what about, Kelly, do you have bringing families home? Is that something that can help with back rent? Maybe? Mariah, Terry, can you think of any other? Okay, never heard of it. I think I would just, I don't know of any services that are available for that for California, but I think, I'd look into your counties. What about CalWorks eligibility? Sometimes they can help with funding. We have a second question from Joanne. What evidence-based practice model are you using? Also, how do you integrate, public health nurses into your engagement with families?
So I can talk to the integrating public health nurses into our engagement. We often take our public health nurse out with us on immediates or on 10 days. And so if we're seeing a need, we have her going out with us along with rapid response team. So she's very, very involved in our responses. And Mariah, do you want to talk to the evidence-based practice?
Yeah, we use a lot of, so our different evidence-based practices we used, we are, life-based crisis intervention trained, so we have that background. We offer nurtured heart approach, which is an evidence-based practice. All of our staff are trained in that. Sorry, we're also, like I said, that domestic violence certified. It's a 40-hour course, and we can actually become an advocate through that course as well, which is a great evidence-based practice that we utilize as well. I think that's all. I can look up the links. The life-based crisis intervention training, you have to have somebody that is a certified trainer train you in it, but it is one that our county offers. So yes, I will. I don't know if they're in the slide. I think I just touched on them verbally. So yes, we'll get you a list of them.
Do you have the person's information to send?
Yeah, Joanna, will you send me your email and I'll copy it and go ahead and send it out?
Okay. Do we have any other questions? I'm not seeing anything in the Q&A. I just want to say how much I appreciate the rapid response team coming to Nevada County. I'm glad that we brought this to our county and that we are providing those preventative services up front. It's really been nice to see families be successful in the program and youth be able to stay safely in their homes with their primary caregivers. Thank you all for joining us today.
And if we don't have more questions, on behalf of Caltrin, on behalf of the participants, we want to thank you for being with us today. Thank you for providing some of your best practices. We really appreciate it. And for those of you attending, and you can see all the thank yous in the chat as well. So if you are someone who would like a certificate of attendance, please feel free to fill out the survey, which we're going to drop into the chat. That survey does allow us to gained some of your takeaways. We provide a survey at the end of every single session that really helps Caltrin in the way that we do our things here. So we'll ask you to fill out a very brief survey, and then you'll have access to the certificate of attendance immediately following it. Stay tuned for a follow-up email with resources and recording replay from today's session to your registration email in the next 2 days. Thank you all so much and have a great afternoon.